Abruptio Placentae, a challenging obstetric emergency. In the realm of obstetrics, the health and well-being of both the mother and the baby are paramount. However, certain complications can arise during pregnancy that pose significant risks. One such complication is Abruptio Placentae, a condition that demands immediate attention and intervention. Abruptio Placentae, also known as placental abruption, refers to the premature separation of the placenta from the uterine wall before delivery. This potentially life-threatening condition can have serious consequences for both the mother and the fetus. The placenta plays a crucial role in supporting and nourishing the developing fetus throughout pregnancy. It attaches to the uterine wall and establishes a connection between the maternal and fetal blood supplies, allowing for the exchange of nutrients and waste products. However, under certain circumstances, the placenta may detach partially or completely from the uterine wall before delivery, leading to Abruptio Placentae. The exact cause of Abruptio Placentae remains elusive, but several risk factors have been identified. High blood pressure, particularly in pregnancy-induced hypertension or preeclampsia, is a significant contributor. Trauma, such as abdominal injury from a motor vehicle accident or a fall, can also trigger placental separation. Other risk factors include advanced maternal age, smoking, drug abuse, previous incidences of Abruptio Placentae, multiple pregnancies, and certain genetic factors. One of the primary manifestations of Abruptio Placentae is vaginal bleeding. However, the amount of bleeding does not necessarily correlate with the severity of placental separation. In some cases, the bleeding may be concealed, occurring within the uterus, and not visible externally. Consequently, other signs and symptoms should also be taken into account, including intense abdominal pain, uterine tenderness, back pain, frequent contractions, and signs of fetal distress, such as decreased fetal movement or an abnormal heart rate pattern. Prompt diagnosis of Abruptio Placentae is crucial for the well-being of both the mother and the fetus. Healthcare providers employ a combination of clinical evaluation, medical history, and diagnostic tests to confirm the condition. Ultrasound imaging is often utilized to assess the extent of placental separation and evaluate fetal well-being. The management of Abruptio Placentae largely depends on the severity of the condition and the gestational age of the fetus. In mild cases, close monitoring of the mother and the baby, along with bed rest, may be sufficient. However, if the placental separation is significant, immediate delivery of the baby may be necessary to prevent further complications and ensure the well-being of both the mother and the fetus. In some cases, a cesarean section may be performed as the preferred mode of delivery. Abruptio Placentae is associated with various maternal and fetal complications. Maternal complications include hemorrhage, disseminated intravascular coagulation, DIC, organ failure, and the need for blood transfusions. The fetus may experience oxygen deprivation, leading to intrauterine growth restriction, premature birth, or even stillbirth. Additionally, the condition increases the risk of developing complications during labor, such as placenta accreta, where the placenta invades the uterine wall. Prevention of Abruptio Placentae is challenging, as many risk factors are beyond our control. However, maintaining a healthy lifestyle, attending regular prenatal checkups, and managing chronic conditions like hypertension can help reduce the risk. Prompt medical attention should be sought in case of any abdominal trauma during pregnancy, even if there are no immediate symptoms. In conclusion, Abruptio Placentae is a serious obstetric emergency that demands swift recognition and appropriate management. Timely diagnosis and intervention are crucial in preventing further complications and ensuring the well-being of both the mother and the baby. Healthcare providers and expectant mothers alike must remain vigilant, and efforts should be made to raise awareness about the signs, symptoms, and risk factors associated with this condition. By doing so, we can work towards reducing the incidence and impact of Abruptio Placentae on maternal and fetal health.